It's Dr. Dennis Long, Sports and Regenerative Medicine. Today we're going to talk about shoulder injuries. Had a rash of shoulder problems recently, a bunch of shoulder dislocations. This particular person was riding a horse in the Grand Canyon, fell off, dislocated his shoulder, and in the process he tore his glenoid labrum. We look at your shoulder. The humerus is the large bone in your arm, and it sits in a socket called the glenoid rim here, and there's clavicle. When it dislocates, it pops out of this, and you can see on this x-ray that the bone has clearly been dislocated. Sometimes it can be self-reduced by the patient. Other times in the emergency room they have to put it back in. But in order for this to get here, there's going to be trauma. And the rotator cuff and often the labrum, which the glenoid labrum is a cartilage rim that lines this. Here you can see this overt tear in the labrum. And this occurs because in order for this to get out here and be dislocated, it's such a violent injury that the soft tissues, the cartilage and the soft tissue surrounding it, something has to give and something has to tear for this to happen. Even if they put it back in place, there's going to be soft tissue damage. So we clearly see this labral tear, and this is what happened to this patient. We're going to talk a little bit more about his story.